Of your busy day to join us here today. I am pleased to share some exciting news that we have on the dental front at Mutual of Omaha. It has been in our product portfolio now since 2017. And a couple of years ago, we started hearing some agent feedback of some product tweaks that they would like to see regarding the portfolio. And I am happy to share that we have those tweaks now ready and installed in the majority of states. And that is what we are going to be reviewing here this afternoon. So welcome everybody. All right. So just a few reminders on what we do have available for dental. So we have two plans that are available. It's the preferred plan and the protection plan. Both of them are issue ages of 19 to 99. So really broad market product here. They were designed really though with the Medicare supplement buyer in mind. So they are a perfect complement to each other. Both of these plans are guaranteed issue and they are zip code rated. And I have a few rate examples here as we progress through this presentation deck that I'll show you what I mean by that. So regarding these two plans and the calendar year deductibles, the preferred plan has a very small $50 per year deductible for both basic and major services. When it comes to preventive, there is no deductible for the preferred policies. On the protection plan, it's a $100 per year combined deductible for all services. So still pretty small deductible there to be met. With respect then to the preventive, as I mentioned, both of these plans pay at 100% after the deductible has met on the protection plan. And that's going to mean the insured does not have any out-of-pocket cost with that type of service. On the basic services, which is going to be something like a filling or a simple extraction, the preferred plan pays at 80%, the insured pays 20%. And then on the protection plan, that's where the plan pays 50 and the insured pays 50% of that expense. And then here is where we've made some changes, which is going to be with major services. So things like a crown or dentures. Prior to this change being made, both the preferred and the protection plan paid 50% after 1 year. Now the change is both of these plans offer day one coverage at 20% for major services, and the insured would pay 80%. Then after 1 year, both of these plans pay at 50%. So big, huge enhancement to these plans. We are getting really great reviews from the distribution. Your customers will be happy knowing that they do have services for major right out of the gate when they purchase this policy, and they don't have to wait that necessarily that full year for benefits to kick in. So very, very excited to share that news here with you all today. And then one other enhancement that we made was with respect to the calendar year max benefit amount that is available. Prior to this change, the benefit amounts were either $1,500 on the preferred or $1,000 on the protection. There was no choice for the consumer involved regarding their max benefit amount. But with the enhancements that we just released here in mid-July, both of the plans now offer for that consumer the choice of either $1,500, $3,000, or $5,000. So the choice is theirs as to what they would like for their calendar year max benefit amount. So we're hearing from a lot of agents, I'll probably go with that middle of the road option, 3,000. But I've talked to agents this week and they actually have been selling the $5,000 benefit. So it's really truly up to that individual consumer and of course their budget as to which plan's best going to meet their needs. But we're happy to now have these higher maximum benefit amounts available and out to the distribution. So let's kind of take a look at the states that have these new enhanced benefits available. We don't have all of them ready for release right now for each state. Some of them are still pending Department of Insurance approval. Once we gain that approval, we will release additional states into the market with these enhanced benefits. Up until then, the states that are in the dark blue shading have what was the standard benefits, which is the products, the way they looked before these enhancements went in. So there's only a handful of those states that don't have the enhanced benefits. The majority, which are going to be in the lighter blue shading, such as like Texas, Missouri, Illinois, where I'm at today, Nebraska, all of us have these new enhanced benefits available to new applicants within these states. And then if you're curious, what do the numbers mean below the state name? That is going to reflect the number of in-network dental provider locations available within that state. So for example, in Missouri, there's over 4,300 in-network dental provider locations. In Illinois, it's almost 14,800 in-network dental provider locations. And if you're curious about our network, if you added up all those numbers on the state map, you would have counted up to over 406,000 in-network dental provider locations across the entire country. And we have partnered with Dental Max Plus as our network, which has participating dentists from Dental Max, United Concordia Dental, as well as Connection Dental. And I did just want to point out here that working with a dental policy that is associated with a network is going to mean lower out-of-pocket costs for your consumers, especially when they use that in-network dentist provider, because of the negotiated savings through working with the network, which, depending on where they can live, can really range anywhere from 25 to 55%. So that is the benefit of working with a plan that is associated with a network. And I know probably the number one question and the first thing a client will ask you is my dentist in network? So we're going to give you a moment now to write this website down. It's dentistforme.com. And then you have to remember the / Mutual of Omaha. And if you go to that website, that is where you can do a provider search, either by dentist name or by location, and search by how far out you want to go. But that is where you would be able to find any of the in-network providers that are included in the network. And then in addition to the preferred plan and the protection plan, both of them also have an optional vision rider. So this is a rider that you can add on during the application process. It is a reimbursement plan, and then you do have to have one of the dental policies in order to have the vision rider. In most of the states, it's $8.28 per month, and it provides for benefits of $50 per calendar year for eye exams with no waiting period, and then $150 every 2 calendar years for eyeglasses or contact lenses. And then even more exciting is when you do a cross sell between our MedSup and a dental policy, the dental premium receives a 15% multi-product discount. So that can save your consumers additional dollars when you're doing these applications at the same time. Now, technically, the rule really is within 30 days of the MedSup issue date, but I don't want you to forget this great product and add it in so they can get that discount. So I always encourage the agent just to do it at the time of sale. 30 days will be here and gone before you know it, and then they will miss that opportunity for the 15% multi-product discount. So definitely take a look at that. And then speaking of the premium rates, I pulled a few zip codes here from the state of Missouri and Illinois, just to give you an idea of what the premiums look like for these two products. So here in the state of Missouri, there are 3 zip code areas, and I have them all listed out there on screen. And then I am quoting here for the respective zip code shown, the preferred plan and the protection plan. I have included the 15% multi-product discount with these premium rates shown. And I'm also showing what that pricing is at the $3,000 annual max benefit amount. So you can see the most expensive cell is going to be the preferred plan and this bottom row of zip codes. So 5054 per month. And the least expensive plan is going to be the protection plan in like a zip code 63801, coming in at 2208 per month. Now, if you, we do have a dental product and rate guide available, which Sadie has available and can send out if anyone would like it. But you can also download our mobile quote app if you haven't already done so, which case you can quote any of the products that Mutual of Omaha has available, including dental. And to download that mobile quote app, all you need to do is go to your respective app store and then go ahead and just search for quotes for sales professionals. And right when you do that, you should see our logo show up and you'll be able to download that. And then you'll always have the mobile quote app right there in your pocket and can quote dental rates, med sup rates, final expense, whatever product it is that you're offering through Mutual of Omaha right from your smart device. And then here's some examples for just the state of Illinois and what the premium rates look like there. Pretty similar. You'll see the most expensive cell, this preferred plan in zip code 600 to 608, coming in at $58.28 per month. And then the least expensive cell is going to be the protection plan at $23.10 in the zip codes noted here. So really affordable, I think. Just from a pricing perspective, these premium rates definitely put us in line with the rest of the market, if not a little bit less expensive. But for a really good plan, especially when you can add in that 15% multi-product discount. And then this is what that product and rate guide looks like. So this is available either to order or just download from our website. So I definitely encourage you to take a look at that. And it does have the premium in there as well by zip code listed out. So very handy reference piece. And then just a couple of incentives that go along when you sell our dental product. One is going to be our marketing credits program. And you might be familiar with this from the MedSup side of the house, in which case, in any given month that you have 5 or more issued MedSup apps, you earn marketing credits, which credits are earned at 1% of the annualized new business premium. But you also earn dental credits when you write dental. And dental, you only have to have 2 or more issued apps in a given month to qualify. And then once you do so, you earn credits based at 1% of the issued dental premium amount. Those credits then go into your bank. And at the end of the qualification period, you can then redeem your bank for cash. And we redeem back for eligible expenses, such as maybe you bought leads, maybe you had postage from a mailing that you had done, maybe you attended the Medicarians conference. Whatever amount of money you have in your bank, as long as you have a receipt for it and submit it to us, and it's a qualified expense, we will reimburse you up to the maximum that you have in your bank available. So I'm going to say that's a very unique program within the market itself. And then the other item available with dental is you have the opportunity to join us next spring in 2024 in Barcelona. We are known for our trips, and this is going to be the first time that we have been to Barcelona with our mutual sales leaders trip. So I hope to have many of you here on the call today join us for that trip. And if you need added incentive, MedSup earns dollar for dollar per ANBP, and dental earns double credit. So if you are writing a MedSup and a dental for that one consumer at one time, you'll be earning trip credits to join us in the City of the Sun. You need 250,000 total production credits for the calendar year 2023, and then we will see you in April of 2024 on that lovely trip. So you're probably wondering, those benefits look good. I like the incentives. I enjoy doing business with Mutual of Omaha, so we're very easy to do business with. And this dental product is no different. So I thought I would run through and show you how to complete an e-application for this dental product, and you'll see how easy it is. So we did launch a new e-app enrollment tool at the end of May of this year. We refer to it as Storefront. And the beauty of the Storefront is it's making it easy for you to not only sell MedSup, but making it easy for you to sell MedSup and dental together. Or you can actually just do standalone dental, which is what I'm going to show you here today. And everybody likes being part of a group. And I did just want to share right now our e-app adoption rate, meaning how many of the applications that we receive are coming in electronically. And right now that's sitting at about 83% and continues to grow. So how are you going to do a standalone dental app? Well, once you log into our agent portal, Sales Professional Access, this is what the homepage looks like. And on the far left-hand side, you're going to go ahead and pick Electronic Applications. From there, it's going to jump to the eApp page, and you're going to pick the first button on screen, which is Store or Senior Health Storefront. Click that blue button, and then you're going to land onto your dashboard. So this dashboard is telling you a few things. You can search for customers right here. You have advanced search capability available. This is all the people that you have started either a quote or an application for, or has already signed the application. It's telling you what product you are working with them on. So this first person here, test, you have quoted them a MedSup, you've quoted them a dental, and the scope of appointment for PDP is now complete. And then to start a new application, you do that right from the dashboard, which is button number 3, which says Start Application. When you do that, this little pop-up will come up, click it one more time, and then it's going to launch the quote screen. And this is where you're going to be able to mark a dental only quote or application. If you want to do MedSup and dental together, you just simply don't mark that box and then you would proceed. So in this example, I'm doing dental only. So I marked that box, complete all the information on the screen, and continue through until I get my quotes page coming back. In this example, you can see I'm doing a quote for Missouri, and then you can see I can pick the preferred plan or the protection plan. And then this is the drop down for what max benefit amount do I want? Do I want the 1,500, 3, or 5? Continue forward. And in this one, I'm going to go ahead and say I wanted the protection plan for $25.98 with the $3,000 benefit. You also have the option here to go ahead and email that quote to your consumer, or you can just say, I want to begin this application. And the application itself is very quick and easy for dental. So
Christy, I'm so sorry for jumping in here. We do have a question from Terry. He's asking, can you add hearing benefits or cancer policies to the dental and vision? So I saw that last page. It had that vision writer on there. Or I'm sorry, yes, the vision writer on there. Is there any way to add hearing or cancer policies or any extra sort of writers to this?
All right, so right now we don't have a hearing writer to add on, but they do, if you buy a dental policy, you do get access to one of our value adds, which is Amplifon, which offers discounts for like the testing for hearing aids. So that would be available. And then as of right now, this storefront e-application is only for MedSup Dental and PDP. The cancer, heart attack, and stroke or critical illness product, we have an e-application for that tool or product suite. It's just not within the storefront. So you would access it still from Sales Professional Access, but instead of picking the storefront for the senior health products, you would go ahead and pick the e-application for cancer, heart attack, and stroke.
Got it. Thank you.
Good question. So I'm continuing through with my applicant information. And then the next question is, when do you want coverage to start? And in this example, I could have either picked, I want it to start today or I want a future date. So for this one, I just said I want it to start on August 1st. Do they want a temporary ID card? Yes, they do. Hit next. And then this is where that discount is going to come into play. So the first question for the multi-product discount on dental, are you applying for or have you applied for a MedSup policy with Mutual of Omaha Insurance Company within the last 30 days? Yes or no? Or do you have a MedSup policy with Mutual of Omaha or one of its affiliates that has been issued within the last 30 days? Yes or no? And then you continue forward. And I'm going to mark that, yes, they already have one that's been issued within the last 30 days. And you can see my current premium is showing at $25.98. When I go ahead and say that, yes, they are also having MedSup, you can see the screen updated because I said yes, and now it reflects the discount at $22.08 with that 15% applied. So now we're ready to collect monthly premiums and the premium to get this to issue. And I fill all that out, and now I'm on my producer page and I answer the questions here. And then when I'm done, I submit the application, and I can see that this is pending for the client signature at this point in time, and I can return to the dashboard. At which point now I see on my dashboard, I have that enrollee, Dental Missouri, And I've quoted the meds up, and the dental is actually pending for client signature. So very quick and easy. A few other dashboard statuses just to be aware of as you continue to do e-applications with Mutual of Omaha. There are things in here regarding the scope of appointment and where those are sitting at. There are things like quoted or quote started, or the enrollment's in process, or an application is in process, or it's waiting for client signature, like that dental example. You also see a dashboard status change when the client actually signs the application, or if they completely deny signature and have marked it as such. So very handy for you to know kind of where everything is at with respect to your business coming through. And then just with respect to what signature methods are available for dental, they are the same as what they are for MedSup. So we have two of them available to you. The first is electronic. And for electronic, what do we mean? There is two ways for electronic. The first is either the system's going to generate an email that will be sent to your client. Within that email, it's going to say your dental application is ready to be signed. They open that email, and the authorization number for that application will already be within there. Then they have to authenticate themselves with their date of birth and their name. Then they open up the email. They can review the PDF of the application you completed electronically. They can review the outline and coverage. If they agree to everything on the app, they click I agree. And then they also read the terms and conditions. They click I agree, and then they hit submit. Very, very easy. If they want to sign electronically, they can also go to a website to sign the app, and they do the exact same process. The other option, which I think is probably even faster, is they can just voice sign. And a voice sign means they call into an 800 number, and you give them the authorization number to key in. Then they key in that authorization number, and they authenticate themselves with their name and date of birth. And all they need to do is listen to the automated line. They don't need to talk to anybody. They just hear what the automated line has to say. And at the very end, the automated line is going to ask for them to state their name, date, and that they agree. Once they do that, they have then voice signed their application, and they are done. So pretty simple process, really. And then, of course, if you ever need help, everyone at Senior Marketing Specialist is well versed within the e-application tool itself, as well as the dental product portfolio. So you can always reach out to them, or you can reach out to our sales support team, which supports agents like yourself on the line. And you can do so by calling them at 800-693-6083. And they are also willing and able to help. And then just because Sadie mentioned that we got AEP coming around the corner, I wanted to share some exciting news on the Mutual of Omaha front with respect to some things coming here right before AEP, which is going to be one, earlier this year we did launch the very first season of the Return of Wild Kingdom, Protecting the Wild. It launched on January 2nd, right after the Rose Bowl Parade. And as of right now, it was marking the 60th anniversary of the show, which debuted in 1963. You can view season 1 episodes on wildkingdom.com. And then really exciting news, coming this fall right before AEP, season 2 of Wild Kingdom, Protecting the Wild, is launching on NBC on Saturday morning. So right in time for your consumers to really be like, oh, I remember that show. I used to watch that as a kid growing up. And definitely your people that you're serving within the senior market remember this show. So we're really excited to have this season 2 launch right before the AEP kickoff. So I really appreciate you all taking time out of your day today. I know that was pretty short and sweet, but it's dental, it's easy, it's a great additional cross sell to offer your clients. And more importantly, I really want to thank you for your time and for your business. So with that, Sadie, was there any additional questions?
Yes, so we do not have any questions. So I have a few of my own, so I might ask you some while we wait for people to throw out their questions. But please feel free to throw out those questions. We'll be here for just a few more minutes, and then we'll get you guys out of here. But Chrissy, I have a question of my own. The first one is, so you mentioned that you listened to the feedback that you got from the agents, and you guys came out with a sort of new and improved product. Hate to put you on the spot, but since you see this day in and day out, what are some of the new, or what's one new benefit or one tweak to this plan that you feel like is really a shining star or like one of your favorite new benefits?
I definitely am going to say that day one coverage at 20%. So your consumers don't need to worry about buying something that they feel they might not get benefit from. They would be covered right out of the gate, at least at 20%. And then if they continue to keep that policy, at least when 12 full months has been cleared, we'll start paying at that 50%. And then even the calendar year max benefit, I've spoken with a lot of agents and they're like, well, at 1500, people just don't feel that for the amount of premium that they pay that there's enough benefit potentially to come out of it. So now having the option of 1500, 3 or 5 definitely opens up to have that consumer really pick the best plan for themselves. So
Absolutely, yes. I love that. We do have a few questions coming in. Are both dental plans a PPO network?
yes, they are both a PPO network.
Awesome. Um, so if you're contracted to sell Mutual of Omaha supplements, are you automatically able to sell dental programs? So are you also contracted to be able to sell that DVH plan?
Most agents would have the dental associated with their MedSup contract. However, if you are not, we do take just-in-time contracts. So what you could do is write, because you're already appointed for MedSup, you can write the dental app. It will pend and it will tell you an open meaning it won't be able to issue. But all you would need to then do is, assuming that you have your MedSup contract with senior marketing specialists, you would reach out to them and tell them that you need to have the dental product added to their business with them. And all senior marketing specialists would do is then send in a transmittal and we will get that added and then that case can issue.
Awesome, great. That's a great question. Let's see, where can we find producer and client material?
Producer and client material is going to be available on Sales Professional Access. Right from the home page, you would pick Forms and Material. If I can find that slide, I'll show you where it's at. So you don't have to search all over. So right when you log in to the home page, you saw where I clicked here, Electronic Applications. Click right below it, Forms and Materials. And then you will search by underwriting company, which is Mutual of Omaha. And then you pick by product type, which you in this example would select dental. And then you can find either marketing material, which is going to be consumer facing, or there's also new business material, which would have that product and rate guide right in there.
Perfect, fantastic. Let's see, we only have one or two more questions, so please feel free to throw those in there. Otherwise, we will get out of here for you guys. Does the premium reflect what max benefit you choose?
Yes, it does. So
Alrighty.
in that example that I did, you saw the premium came back that I was quoting at the dental protection plan. It was $25.98 per month, and I did select the $3,000 max benefit amount for that premium. And then when I let the application know during the EAP process that I was also applying for MedSup, that is when it then changed the premium amount to that 2208. So it automatically applied the multi-product discount right then and there within the tool itself.
Awesome, awesome. Okay, let's see. There's a few questions here. Let me see if I can get my eyes to focus on these. I'm appointed to sell long-term care products. Does that cover everything else? So if they're contracted and able to sell long-term care products, are they able to sell the Mutual of Omaha dental plan?
You would already be contracted with Mutual of Omaha, but I would definitely reach out to senior marketing specialists or to see if you have MedSup and dental. If not, it would be just as simple as them submitting a transmittal to add that product. You don't need new contracting.
Awesome. Let's see. When a person enrolls, can they cancel the plan at any time?
Yes, they can cancel at any time.
Awesome. Looks like we have one more question here. Will Mutual of Omaha reach out to a dentist to try to add them to a network if requested?
Um, is part of the product and rate guide, there is a phone number in there in which anyone can call to the network to ask that a dentist be invited to join the network. So we at Mutual of Omaha don't do the network. The Dentamax Plus takes care of all the network negotiations with the providers. So they would work to see if that dentist would be added into the network and vet them out. But that phone number is within that product and rate guide. I don't have it here on screen, but Sadie, I can send you the phone number if you want to send a follow up after the call.
Yes, absolutely. That sounds great. So, yes, Mutual of Omaha doesn't, but you're providing a number with the dental company that will add them to
Correct.
the network. Okay. Does the 15% discount apply to an insured and spouse application if the current spouse already has a Mutual of Omaha Medicare supplement?
So the multi-product discount, because these are individual policies, it applies if you were enrolling a husband and a wife each in dental, then the 50% multi-product discount only applies if the med sup has been issued within the last 30 days. So if a current med sup client who's had a policy with you for 2 years and now they're adding dental, they would not be eligible for the premium for the multi-product discount. But if it's a new enrollee that you're enrolling in med sup and dental, then they would receive the multi-product discount of 15% on the dental.
Awesome. All righty. He says thank you.
You're welcome.
Let's see. I have one more question for you, and then we will get you out of here. But as senior marketing specialists, we talk about ancillary products. Often we talk about how important they are. Obviously, we know why a dental plan and might be really important for your clients. But Christy, could you kind of explain how beneficial selling or why dental plans can be beneficial for you to start offering to your clients as far as like your agency and growing your business goes?
Yeah, I mean, one, it's a guaranteed issue product. So if you're going to start selling ancillary products, this is a definitely an easy one to start with, and it's broad market, meaning you can sell this thing practically to anyone that you're going to come across because the issue ages are 19 to 99. And I would just say, we all know when you have more products within a household, it's less likely that that consumer is going to cancel one of the other policies that they have with you. So your persistency is going to be higher and you're going to make a lot more money. I didn't mention here because it's kind of old news, but last year in 2022, we did increase compensation on dental quite significantly. If you do not know how much you're set up for commissions on dental, I highly encourage you to call into senior marketing specialist to find out what level you're at because you probably got a big payday and you did not even realize that that was available to you. So definitely call in and ask to see what level you're set at because it is additional monies for you. And people want dental. I mean, in the med sup world, Medicare doesn't cover for dental expenses. And I imagine a lot of the people that you come across and are helping from the med sup side of things most likely had dental coverage when they were in their working years through their employer. Well, where are they going to get dental coverage now? Because Medicare doesn't cover for it. And for something like in the Missouri area here at 2208 per month, that is pretty affordable coverage. It's less than $265 a year. So very comprehensive coverage for them at an affordable price. And you're going to have two sales then for that one client. So,
Yes,
and
absolutely.
hopefully see you in Barcelona because you're going to earn more credits to join us on that trip.
Yes, absolutely. That's a great goal to work for. Honestly, if you're someone who hasn't expanded into the ancillary market, what better goal, what better drive to, start adding those products on for you personally, a Barcelona trip. So looks like we don't have any more questions. Christy, thank you so much for going through this with us today and taking the time. Everyone, this recording will be in the follow-up email as well as some of the resources that we mentioned throughout. But Christy, if you don't have anything else, we'll go ahead and get everyone out of here.
All right. Well, thank you so much, Sadie. Appreciate you all and stay cool out there.
Yes, absolutely. Thank you.
All right. Take care.